Let's talk about shoulder problems. In our clinics, we see a lot of shoulder patients. They are coming with all sorts of symptoms. Our role as a physiotherapist is to find out what's the cause of these symptoms. Is it cervical spine, thoracic spine, or the glenohumeral joint itself, or the scapulothoracic joint, or all of them? That's why, if you would like to start your examination procedure or assessment procedure for shoulder patients, we have to listen very well. I'm going to give you some examples to show you how good listening can give you a very valuable information that will guide your physical examination. We have quite a few examples here. First of all, lady that has shoulder pain after a fall on the snow. She came to you with pain around the shoulder, she's stiff, and she can't move it in different directions. We have two options. The first option is try to find a diagnosis, try to give her a name. The other, more helpful option, the more realistic and logical option is to break down her problem into small problems. First of all, we have to make sure that there is no serious pathology or serious conditions. For example, there is no fracture. And you can do that by referring her for X-ray or scanning. If the X-ray has revealed no fracture, in this case, we need to look at this patient as shoulder patient musculoskeletal problem, which is she has problem on moving the joint. By time, she has developed some sort of motor lack of activation or muscle lack of activation. And maybe she also has developed some neural mobility dysfunction. If we consider these 3 points, we can design our physical examination. So the main important element of our physical examination will be active and passive range of movement, in order to identify which range is affected or which range is limited, and also in order to observe the pattern of movement that she's using. Once we do that, we can simply identify the most appropriate treatment strategies. If she has a stiff joint, we can mobilize, and we also can provide her with some movement strategies to regain the harmony between the different muscles around the shoulder joint, in particular the rotator cuff and the scapular muscles. If she has limited neural mobility, we can provide her with neural gliding exercises in order to improve the neural mobility of the tissues. Another scenario, if you have a patient who has sort of clicking or clucking of the joint, and in this case you might think about instability. If you listen well to the patient during the history taking process, you can tell exactly if the history is indicative or is indicative of instability. And according to that, again, you have to choose the physical examination procedures that might fit this patient. Surprisingly, you will find that active and passive range of movement still the same, the most important element of the testing. I haven't mentioned the name of a special testing with these two patients, because simply using special testing will be definitely positive for the first lady, because everything is painful. She has a stiff, painful joint. With the second patient, you might argue and say using testing like instability testing, like apprehension relocation test, might provide you with some indication about is it actually instability or other problem. But by the end of the day, you'll be surprised, I'm sure you are not because you are an experienced clinician, that when it comes to treatment, it's mainly about providing the patient with a treatment package that include arthrogenic management, myogenic management, and neurogenic management. All these managements will give the patient a short-term effect unless you provide him with a very clear exercise program that doesn't include too many exercises. Make it simple and functional. This treatment will not also be complete unless you change the patient perception about his problem. You have to convince your patient using your own communication strategies that his problem is not a long-lasting problem, and lack of movement is actually not going to make the problem better, it actually will make it worse. This is a very simple example looking at the shoulder joint, how our ability as a modern manual therapist to identify the patient problem through listening, through using or choosing the right questions, in order to guide us through the physical examination procedures to end up with a comprehensive treatment package.